All right. Thank you. Thank you, Lisa, for the kind and warm introduction. Welcome, everybody. Thanks for joining me wherever you are. I'm in Portland, Maine. Glad to be here. Had a great day at the office. Great way to start the week off. And I know many of you who are coming to this presentation have seen this before. So there's some new stuff in here. And I know that you pick up new things each time that you go along. So if it's not obvious at the end of this, or if you've never seen me speak before, you know that I really like connecting with folks afterwards. So please feel free to reach out to me. I'll have all of my contact details at the very end. And of course, I want to give a huge shout to Catapult. I'm a Catapult speaker. I'm very proud to be part of this organization. It's interesting because the folks that are in this group with me are, many of these members are people that I consider all-stars in dentistry. So for me to even be listed next to them on the webpage is absolutely like mind-blowing. It's very surreal to me. Seeing these people live is kind of like being starstruck in a way. So I'm very proud to be a part of that. Very grateful that they are hosting this webinar tonight. Very, very grateful also for Smileline USA. Thank you, Chris Bradley. Thank you, Smileline. I've been great friends with those folks for a long time. They've always supported me. And I'm glad to be, getting back to doing webinars and live events again, where I can speak for them. So sit back, enjoy. Let's get into it, you guys. So again, my name is Miles Cohen. Again, many of you guys know me. Some of you know me as a lab technician, and some of you guys know me as a prosthodontist. And you know that I restore a lot of implants. I prep a ton of teeth. I like to do a lot of dentures. But it's interesting, again, because every time I go and speak, at the end of the presentations, people very rarely ask me about what implant systems I use or what coarse grit diamonds do I use or what denture teeth do I use. All they want to know is, how do I take better photos, right? How do I get more referrals? How can I use my photos to get better patients? How do I communicate with my laboratory technicians? So that's kind of what we're going to go in today. And I want to just tell you guys that, I think photography is like any other skill set in your daily practice, whether it's endodontics, whether it's taking teeth out, whether it's, delivering a crown or making a final impression. It's just another skill that I really think you need to learn. And one of the best things about photography for me, and I'm giving you just some of the back end, some of the behind the scenes information, is that photography for me has been, it's been a tremendous brand builder, meaning that patients have found me and have come to me rather than maybe some other dentists because of that branding that I do with photography, showing a lot of the before and after. So photography is really it's just your ticket to play, all right? And I think once you've added this to your repertoire, it becomes very addictive and it's hard to go back. So you've been warned. So there's three questions that typically come up when I'm talking about photography. People always want to know, what are the different types of photos that I can take, and then it makes me ask them this question about, well, what's the motivation for these photos? Why do you want to do it? And when people tell me that they want to take better photos, I have to ask them, what does better mean? Because better for, a novice, somebody just starting out, it might be different than for me when I say, well, I want to take better photos, right? So just so you know, there's generally 4 different types of photos. There's the intraoral, extraoral, benchtop, and portrait. And we're going to briefly touch on these in this presentation tonight. And just so you guys know, each one of these types of photographs could be an entire full day course just on this, and you'd still only just skim the surface. And so for the 4 different types of photos, there's also coincidentally 4 different uses for dental photography. One of them is lecturing, right? Kind of what I'm doing with you guys tonight. I'm doing a webinar. Or if you're on like the big stage at one of the major meetings, at one of the symposiums, right? It's important that you have nice photos, something catchy for the audience to latch onto, right? And then peer review. So this entire weekend, I just spent the past 2 days straight, probably 10, 12 hours each day writing a paper where, a big part of that was the photography that tells the story behind the actual literature that's in there, right? And then collaboration as a specialist, right? I'm a prosthodontist, so I'm constantly speaking with the other specialists, whether it's the oral surgeons, the endodontist, the periodontist, doesn't matter. Other prosthodontists, right? I need to show them photographs to help communicate so that I can help my patients. And then something that's interesting is the branding, right? So I get a lot of companies, I speak for a lot of different companies, and they send me, packages and products and things that they want me to take photos of so that they can put that in their brochures and show it on Instagram and social media and things like that. And, you know, that actually pays oftentimes better than what my patients will pay me. So again, it behooves you to learn this skill. So type 1 is the most common. Most of you are probably doing intraoral photography now. You should be, you know, and this is the big thing with this is for shade analysis, right? So that's the most common one. And this can really, really help you. You guys should be taking photos if for no other reason, just to communicate with the laboratory technicians. The second types of photos are the extraoral. Extraoral photos are actually very, very difficult because you have this weird interplay of light and the surfaces. And so in order to get these types of photos, I use special brackets, right? I don't just use a ring flash, and I will talk about that a little bit. This was a denture that I did for a company called Vita. These are one of their new teeth that they came out with, and they really liked the texture on here, and they wanted to know if I could find a creative, unique way to really show off the texture of their teeth to show that it looked like natural teeth. And so with this denture patient here, you know, they have the lips and the vermilion border and that kind of like wet, dry line, and they've got their epidermis, and this was an older woman who had really dry skin. You know, and then I've also got to show the acrylic in there too. So getting all of those things to look just right, you know, takes a little practice, takes a little playing around with it. So one of the things that I use to do this are these light brackets. And this is an owl bracket. I love the owl brackets made by my good friend Oscar. He's in Turkey. He's also, he's a general dentist in Turkey that makes this phenomenal product, and it's won a bunch of awards. And you can see it kind of looks like an owl when it's unfolded, and you know, he scribes your name on there. He like laser cuts your name on there on the arm of this thing. So that's really, really cool. The way that this looks when it's on your DSLR is kind of like that. Oops, let me go back. That's kind of what it looks like when it's on your camera. So you can imagine this is a really heavy setup. For those of you that think that, you know, the task of dental photography is really daunting and or expensive, you know, stay tuned to the end because I'm going to show you how to take really good photos with just using your cell phone. Third type. This is something that's very near and dear to me, again, because I'm a laboratory technician, but it's the benchtop photos. And I think showing this benchtop photography is really great if you are going to lecture or if you are writing papers, because it gives some context to the case. Anybody can show a before and after photo, right? But it's kind of meaningless without some of the in-between, right? So I think showing these steps really helps kind of move along the story and helps really show whether it's patients or other dentists, sort of, you know, what's going into this, and shows some of your passion. And then portrait photography. Now, portrait photography is actually the most difficult type of photography, in my opinion, but not for the reasons that you think, right? Usually when patients come to the dentist, they have no reason to smile because number one, you're expensive, and number two, you're going to hurt them, right? What's there to grin about? Not a lot. So this is Dan, and we just put a single central veneer in on Dan, and he was really happy at this point, right? This was not during my initial consultation with him. This is at some point between me bonding that veneer and him going to check out and finding out he still owes $2,500 to pay for that veneer. So, but you really want to get the patients to like smile and laugh with their eyes, what we call a Duchenne smile. In order to do that, you need to build some rapport. Now, some of your patients will just be nutty. They'll be like Kirsten here. They'll just be kind of nutbags right from day one. There's no really telling which one of those patients it's going to be. When you get them though, man, have your camera ready and get a lot of photos, because you'll get shots like this that you'll never forget. And you might notice that, hey, you know, a lot of his portrait photos, they're all in black and white. Well, that's not by accident. I initially started taking black and white photos, or making my photos black and white, because I didn't understand how to do color, and I couldn't get the skin tones consistent between photos. So I started making all the portrait photos black and white. And then after a while, I thought, hey, this looks kind of cool and classy. It looks stylish. So I just kept it like that. Now that's become my own personal style. So when people see the portraits in black and white with the rest, they're usually like, oh, that's a Miles Cohn photo. And this quote by Dominic Rouse, color is everything, but black and white is more. You know, I just love that quote, and it seemed fitting for this portion. So common questions. You know, so I know a lot of people watch this because they're like, oh, I want to figure out how I can take really, really good photos for Instagram. I want to see how I can get good photos and content for my social media, for Facebook. I want to be Facebook famous, right? Being Facebook famous is kind of like being rich in Monopoly. It doesn't really mean much these days. But nevertheless, let me show you some, you know, tips and tricks for the background stuff, right? So everybody's photos on Instagram, it looks all wet and slick and shiny, right? And this is what we call a low-key background, meaning it's black, right? And that's that differs from a high-key background, which would be pure white. So, and let me just go back to talking about branding and marketing and things like that, right? So again, when you really start having really nice photos, companies and magazines, they will come and find you, right? And they will start asking you like, hey, Dr. Cohn, I noticed you have this really cool photo on Instagram. Can we buy that from you? And I'll let you know, oftentimes I will sell single images to companies for upwards of around $3,000, right? So not a bad day at the office when you can take one photo and sell it for $3,000, right? I mean, how many, class 2, composites you need to do to make that kind of money. So, and then the other thing is too, companies, magazines, journals will reach out to you and say, hey, will you write a paper for us? And again, so what I'm talking to you guys about now, this is a mode of dental photography, and JDT, Journal of Dental Technology, said, hey, would you write a paper for us? And when you put that paper online on your website, that carries a lot of SEO with it. That's free advertising for you in your office, right? Patients think it's outstanding, and patients like it when you fuss over them. So, and again, in a small place like Maine, word of mouth gets around. So for me, that's really, really important. So to get these types of photos that you're seeing here, where it's got this nice reflective background and all the images, whether it's acrylic, zirconia, porcelain, metal, right, where it all looks slick and shiny. I use this thing called a flash donut. And this thing is really, really inexpensive. You can get this for around like 25, 30 bucks on Amazon. And this is hooked up to my camera, and that's a big giant mirror. Again, I bought on Amazon for like 8 or 9 bucks. And that's creating that black background with the reflection. And just so you guys can see, this is what this is on Amazon. If you want to take a snapshot of this, if you don't have your phone near you or you're not able to screenshot, just give me a shout on Instagram later on, or hit me up on my webpage, and I'll send you the links to all of this stuff. So when you're doing photos like this, again, it's cool to post this stuff on Instagram, but, really start to think about who's your target audience. Is it really like the laboratory or other dental offices, or are you mainly trying to create a brand and target dentists and patients, right? So this dental marketing is a big part of this, again, if I haven't stressed that enough. And I just want to make something very clear to everybody watching this. Many of the photos that you see that I post on Instagram, like, that's not real, right? Like, I mean, so you take a look at these images on the right where I'm doing these shade photos for a denture, right? So GC America paid me to take these photographs and put it in their brochure, right? And I spent probably an hour taking these photos to get it just right. So the 3 images that you see there, that's a compilation of probably like 100, 120 different photos that I took, right? Now I post that on Instagram and people think, well, gosh, my photos don't look like that when I try to communicate shade with my laboratory. Maybe that's why my dentures don't look good. That's not it. These are like hardcore edited, man. When I send photos to my laboratory for shade communication, it looks like this photo on the left where the patient's, she's got a big beefy tongue there. You can see the angular colitis on her lips. You can see she's even got a little bit of a mustache. Like, that's what my photos look like. And the same thing for my fixed restorations. Like what you guys see on Facebook and social media are these images. This is what goes in the magazines, right? These are 2 zirconia crowns on number 20 and 21, right? Though everything else is natural. And you see the images on the left-hand side where I'm doing the shade photos and the stump shade, right? But these images over here where I've got everything sort of masked, right? Using these intraoral contrasters, these flexi palettes that I'm going to talk about in a minute here, right? That's staged. I set that up. Like, gosh, I don't have time in my day to do every photo like that. If you do, then, you need to start charging more or find a different profession, right? Like, you need to start advertising better because you don't have enough patients. Like, I don't even see that many patients. I see maybe 2 or 3 patients a day, and I still don't have that kind of time to stage every photo like that, right? But these photos are staged. So I just want to make that very, very clear. And so let me tell you guys just a little bit about these intraoral contrasters that I use. Like, this isn't Photoshop. A lot of times people see these black backgrounds and they think like, oh man, that's like been Photoshop. It's not Photoshop. So Smileline makes these really fantastic, fully adjustable, neoprene coated, autoclavable contrasters, right? And a contraster just goes behind the teeth and creates a nice black background. And they have them in all of these different like shapes and varieties. And you can buy them a la carte. You can buy them as a package. Right. And I probably have like 10 of these sitting around, and I use them all day, every day. And I've had them for, I think Smileline gave me the first package of these. Gosh, I think it was like 2013. This is like eight, almost 9 years ago. And I still have the same set and they still look brand new. And they say not to put them in cold sterile. I've been cold sterilizing mine for like the last 5 or 6 years. It doesn't do anything to them. But these are fantastic. And this is what this looks like. So when you see these types of photos, like, I'm not photoshopping out the background. Again, I just don't have that time. These are these neoprene contrasters. And the thing that I like about the neoprene, a lot of you guys have probably seen like a lot of the metal ones out there. This is what the metal ones look like. And I just don't like it. Number one, the metal kind of hurts, kind of digs on a patient's gingiva if you're doing this, but also look at the glare. Like that metal has a little bit of a sheen to it. And after it goes through the autoclave, it's got sort of this like oily finish on there. I just don't like it. I really like the nice matte finish that these neoprene flexi palettes have. And so this is what this setup looks like. I'll kind of show you this. So when you have a patient sitting in the chair, I usually have them retract their cheeks. So they will retract their own cheeks. I'll have them help me to help them, right? And then the flexi palette, again, you can bend it and manipulate it and it doesn't hurt. And if you get your patients to open up wide enough, you kind of put it in there. And then again, nobody's holding on to that. I don't have an assistant hold that. I let it just kind of like sit there, and like pretty much all my patients can tolerate that. Right. And so this is the difference between having the patient without, you know, something in the background versus something else there. And these are my wife's teeth, by the way. She's got wicked, gnarly looking teeth, man. I'd feel sorry for a ceramist if she ever breaks one of these in half, if they have to try to rebuild these. They have such texture and contours and stuff, but you can see the big difference, right? And this is really nice when you want to communicate shade, or again, you want to put this in a publication or put this on the website. It's a big difference there, right? And now, a lot of times people think, you know, a lot of the stuff that I show, they're like, man, some of this stuff is really expensive. You know, I don't have like a really big photo studio to show this often. You know, what am I going to do? This isn't fair, you know, or this is just not feasible for me. So, you know, I mentioned the low key background, which is like those black backgrounds. That's what those contrasters produce, is a low key background, right? But sometimes people really like the high key backgrounds, right? So that's that pure white, sort of ethereal looking, you know, sort of like misty, smoky looking background. So how do you get this background, right? You must need like really expensive lights to light this up. Well, that's not so. So these are some articulators. This is by a company called Amann Gierbach that I also speak for. And they sent me this. This was a limited edition articulator that they sent me, and it just begged to be photographed. So I said, you know what? I'm going to take this home. I opened it up out of the box at my office. I took it home, and somewhere in between like making dinner and helping my kids with their homework, you know, I set up a do-it-yourself photo studio. So this is in my house. You can see it's pitch black outside, and I've got that flash donut again, probably the best $25 I've ever spent in photography. And then, you know, maybe aside from the $3 piece of white t-shirt material that you see laying there that my wife actually bought me from like Joanne Fabrics or something. So I've got that laying over my camera bag there. And then I'm just bouncing the light from my camera. I've got it set up. I've got the flash set really high, so that light is reflecting off of that white background and illuminating that articulator like that to create that really, really nice setup. So, and again, like I don't do any surgery in my office. I don't place implants. I don't do bone grafts. Like as a prosthodontist, military trained, we were taught that you stay in your lane. I do prost, and that's it, man. I don't do any surgeries. So when I go to the surgeon's office, there's no way I'm bringing in all of this big equipment, like the light boxes and stuff like that, that I'll show you guys in a little bit. So when I'm at the surgeon's office, right, this is me holding onto a little bit of a xenograft. You know, I need some way to photograph this in a way that's not intrusive to the patients and to the other doctor there doing his stuff. So, you know, this patient's there getting implants placed, and I'm sitting there in the background. And so what I do is I took this little vial and I held it up to the lights, and you can see in this middle photo, you can see I've just got that ring donut again. You can see the outline of the flash that I'm using on that little vial there. And this first photo looks kind of green and sickly. It didn't look really that great. The second photo, you can see it's a little bit brighter. So I adjusted, tweaked some of my settings, and I'm getting closer. And then this image on the left, the one that I first showed you, is the final one that I had. So again, it takes a little time, takes a little bit of practice, you know, and again, every photo that I take doesn't come out great the first time. You know, it's a labor of love for sure. All right. So we'll talk about, if you want to do something that's a little bit more intense, you know, you don't want to just, you want to do something a little bit more. I'm going to show you guys how to use an Octabox to do these high key setups. And so this is what an Octabox is. This is a deep parabolic Octabox. This thing is massive. And this only costs, maybe this whole setup's like probably less than $300 for the strobe that I'm holding onto and this Octabox. People think like this stuff costs thousands. Man, I'm a prosthodontist and I'm broke. I don't got thousands of bucks. So I've got like, I don't know, hundreds of dollars maybe. So I use this Octabox. Again, this photo that you see here, this was me just holding on to these little veneers on this model right in front of that Octabox to get that nice white look. And again, it shows some of the texture on there, right? You can also put things on top of the Octabox. You can set it on the ground and all that light kind of filters up and creates this really, really beautiful sort of look to the teeth. Again, sort of like a milky white background that just sort of like disappears. And, you know, it's good. Again, like I said, I do a lot of dentures. So here's this photo, and I'll show you a little bit of behind the scenes, how did I get this photo? People are like, how did you get this picture, right? So you notice sort of this wet sort of look that this alginate impression has to it, right? Well, so I took this impression and I took a lab burr, I think I super glued it. I drilled a hole into the tray, the plastic tray that I made the impression with, and then I hot glued the lab burr in there. And so now this is just me at my office, and I've got this set up in the waiting room. After the patients leave, I take this giant Octabox that's on a stand, and you can see in my hand, I've got a little spray bottle there, and I'm just spraying this impression down. And I'll show you behind the scenes here. So I'm spraying it, and I've got my camera here. And as I take the photos, you'll notice the flash strokes going off. I didn't really like the way that that looked. So I'm repositioning this, getting better composition. You see the flash go off. My son comes over with his cell phone, and he's recording this. And you can see pretty much like right off the card, this thing is ready to go. And that's Insta ready, right? I'm ready to post to Instagram. And so, you know, I'm not a huge, anybody who, again, who follows my account has seen me lecture before, you guys know that I like a really dark, moody look. And this same Octabox that is used for product photography is also used for portraits. Again, I try to make good use of all of the things that I have, right? I try to use them as multi-tools. So this is Sharon. And again, in Maine, we have one of the oldest demographics in the country. And so because of that, you know, our patients have a lot of texture, a lot of life in their face, a lot of emotion. I like to capture that. So the reason I use that giant Octabox, I don't like, you know, I don't like these like kind of square panel soft boxes. I think they're really ugly. The light is too harsh. The bigger the light source, the more it's diffused. And I like to create a really natural light. So I try to imagine this is like Sharon just like looking out of a big natural window. And I only have one light because I want to create some shadow. I want to create a little bit of drama. I want to like accent, you know, the crow's feet and the wrinkles on her face and stuff like that. So, and again, here's sort of this behind the scenes. This is how this looks. So again, this is in my waiting room again. And I've got her sitting on just like a little black background there. And this is the 360 view of this. And I've got that Octabox. You can see just up and to the side. And I just pop off a few photos. And you know what? The patients love these types of photos because it's so soft to their skin. And it makes everybody look good. And, you know, our patients are always like, gosh, it doesn't look like I have pores on my face. It's so flattering to these folks. And again, that same Octabox, I can use it now for doing product shots. Again, Aman Gearbox sent me this. This was like a little instrument stand that I use at the bench. And, you know, again, I can do it on a black background or I can do it on a white background. And the idea is that I try to make it look like something that came off of like an Apple website, right? Or out of the Mac store. And anybody who's ever taken photos of metal knows that metal tends to have a lot of glare. So you really need to diffuse that light in order to get this sort of soft, kind of matte finish look to it. All right, now if you want to get even, again, a little bit more fancy, you could do a 2-light setup. So that was a 1-light setup, and now we're going into a 2-light setup. So how did I get this look where it's like light lit from the bottom and white on top? Well, so I went to my ceramist office. This is my buddy Lucas taking photos of that case that you just saw there. And this is behind the scenes. So again, I've got that Octabox there, and this is totally portable. I mean, it folds down into like, you know, a tiny little like soccer ball size shaped thing. I throw it in the back of my car, my backpack, and go to his office. Then I've got a little smaller, little itty bitty baby light underneath there, throwing light up from underneath, right? So that's how we get that look. And again, you can do this with patients too. Sometimes you want that nice white, sort of soft look to it. And so we've got an Octabox up and off to the side of this patient. If you look in her eyes, you can see the catch lights there. You can see sort of the direction of where that light is coming from. It's a dead giveaway. And if we have her move to the side here, you can see sort of the rim and the outline of that Octabox to the side. I just cropped the photo so you can't really see it. All right, so all this talk about Octaboxes and stuff, let's get into equipment. We'll talk about equipment like a little bit. So how do you pick the equipment? You know, there's a lot of different stuff out there, right? You're gonna need like a camera body, lens, you're gonna need lights. Well, I'll tell you that, you know, many of the photographs that you've seen here, you know, unless otherwise stated, cost me roughly about $1,000 worth of equipment. So my camera, for the longest time, I used a Canon T1i. That's what I used in my residency. And again, I sold photos from that T1i to a lot of companies. I mean, you could probably find a T1i on eBay for probably like 100, 150 bucks. I eventually upgraded to a full frame camera, which was the Canon 6D. Again, I got that on eBay for 650 bucks. I now use a Canon 5D. You know, again, I can notice a little bit of a difference in there, but if you're just starting out, or you're just, again, you know, you can get really, really great images from a $650 camera. The 100mm macro lens that I use, again, on eBay for like 200, 250 bucks. This flash that I'm using here, again, I got that on Amazon, brand new for like 75 bucks. And then again, the flash donut is like 30 bucks just to soften your light and make it look nice and silky. So for $1,000, you could have all of this stuff, right? I mean, most of your hand pieces probably cost more than that, right? If you think about how much you spend on, marketing. I know people spend that much on Instagram, they pay somebody to do their Instagram more than that a month. So just think about, the cost of that. It's not much. And I think that, everybody wants to know, well, do you use Nikon, Sony, Canon? I do have a Canon, but I think for most people, price tends to be the great equalizer, which is why I'm trying to tell you, you can really get away with using very, very, very little to get like outstanding professional looking photographs. Now, what about lenses? Which one is the best? Now, the lenses are actually the part where you can spend the most money. I mean, you could get insane spending money on high quality glass, right? So with Canon, they have something called their L series, which is luxury, right? And if you've ever seen Canon lenses, sometimes you'll see that there's a red line around there. What does that red line mean? That means that lens costs a lot of money. So if you take a look here, again, these are my wife's teeth. And this is the exact same camera, the same lighting, same setting, same photographer. It's just me taking these photos just back to back. Same everything, just I switched the lens out. So if you're looking at this, can you tell a difference? I know a lot of you guys have probably seen this before. I've posted this on social media all over the place, but take a look. If I posted these photos on a movie screen and I was at like a symposium lecturing, nobody in the audience would ever be able to say like, oh, that was a Canon lens, or, that was a Nikon lens. Oh, because the reds look like this, or there's a little bit more yellow. No way. There's no way. And there's no way that anybody would be able to say like, oh, that lens, that photo was taken with a way more expensive lens versus the inexpensive lens. So to break the suspense, the top photo was taken with the lens that cost about 750 bucks. And the bottom lens was taken with the lens that cost about 300 bucks. And again, a lot of the stuff you get on eBay, you can get it brand new, but this stuff is on eBay. And word about buying stuff on eBay, most of these people who are selling this kind of equipment are taking pretty good care of it, right? Anybody who buys a red line Canon lens isn't letting it roll around in their backpack with the lens cap off, right? They're polishing that thing with a baby diaper before they go to sleep every night. So again, the Canon gear, Nikon as well, it really holds its value over time. And a lot of times, people are moving to like mirrorless cameras, or they want to start doing landscape photography. So they're selling off their kits of macro lenses. So take a look around. And if you guys are unsure, again, contact me afterwards, send me the link. I'll let you know if I think it's a good deal or not. The nice thing about a lot of this camera gear too, I know a lot of people will use like, I've seen the Shofu Eye Special and some of these other things, and they're pretty expensive. This stuff costs like $3-4 grand. And the thing is, on the weekends, I can still use the camera that I'm showing you guys now in the real world, right? These are photos of my wife and my kids, and we're out at the beach. This is out in, picture on the left is out in Florence, Oregon. The picture on the right is in Kahakama, South Africa. So again, these photos, you can get really nice professional shots. This is my young niece. Again, this is back in South Africa. This next photo is my youngest daughter. This is in Bar Harbor. Again, this is just on the beach. These are all pictures where I don't have any special light setup. It's just the natural light with my camera, and I'm just pointing and shooting, and you can get really phenomenal pictures. Now, something I want to show you that I don't necessarily recommend to everybody, in this quote by Henry Cartier-Bresson, in photography, the smallest thing can be a great subject. And my wife knows this very well, because when I really, really get focused on something, I will spend, 8 hours photographing some of these products just because it becomes so darn obsessive. Now, Canon makes this lens. It's called the MPE 65 millimeter. And this telescopes out. It looks like a bazooka, man. It's like massive. And they use this lens. You can see you can go up to 1 to 5 times life size. Now those 100 millimeter macro lenses, if you have one of those, that's like 1 times life size. So imagine going 5 times your normal macro lens, right? So if you want to take a photograph of a fly's eyeballs and see like the faceted compound eyes, this is the type of lens that you use. You can't autofocus with it. You have to manually focus, and you have to move in and out. And doing that, if you've ever, shot a high-powered rifle and looked through a scope, that if you like breathe, like it moves all over. This is kind of the same way. So these are these comet burrs that you can see here. And again, you get really, really interesting photographs, and it kind of looks like next level, otherworldly type images. This is some, tissue, obviously, with an implant custom healing abutment in there. But again, just look at how gorgeous that pitting looks and that texture, right? It's just really, really stunning. Again, this is the pin of my articulator. Here's some implant drivers, right? Again, you get kind of this blurred sort of look for most of the image. Then you've got this slice of, really high intensity focus. This is on my articulator. Now keep in mind, each one of those little slashes there, that's a 0.5 millimeter increment, 0.5 millimeter, man. And that's what that looks like up close. Here's the bevel of that owl bracket that I showed you guys earlier. Again, you can see the painting on there, the grain of that, right? So to give you some context, this is a wide angle lens that I used to take photographs of these brushes that MPF and Amann Girrbach made especially for me. So here's the wide angle view of this. This is the brushes up close, right? It's pretty intense. And now you want to go even closer right there. I want to zoom in like 3-4 times macro. You can see some of the dust particles on the bristles, on the individual bristles of this ceramic brush, right? So it gets pretty insane. And again, it just makes the commonplace just very uncommon for me. And sometimes when I'm just struggling at work and feeling kind of bored and uninspired, I'll go take photos of just anything that I have laying around. Carpules, right? Remember carpule art was a thing for like 5 minutes on Instagram. So that was like my one, my one journey into that. But again, you can make, this stuff does, it looks like art, it looks next level. It's really, really cool. Now, again, I said, I don't necessarily recommend buying this lens. Used costs about $900. So really consider how deep do you want to go down that rabbit hole, right? Something I would recommend though is a wide angle lens. Now a wide angle lens you can get for a couple $100. And the wide angle lens really helps you, again, create that context that I was saying about the laboratory work. Again, here's a face bow. These are some shade tabs that I had, right? And I couldn't get these photos. In order to get this photo with a telephoto or a macro lens, I'd have to be standing on a ladder with these things on the floor, right? In order to get those all in the same shot. And again, these macro or these wide angle lenses, you can get them really inexpensively for, less than, $200-300 online on eBay. So the reason why I show like the wide and the macro is, again, usually when I'm lecturing, I like to show the two different sides of this, right? So this was a final impression I made for a denture, and like the wide view just kind of shows what I'm doing, right? And then I like to kind of zoom into this with my macro lens and kind of show this almost alien looking landscape, right? And then again, when I do some of these, product photos and advertisements for companies, this is where I kind of start putting it all together. So here's like, using a portrait lens for this shot of me here, macro photos for kind of the blood and the gore and the guts, and then a wide angle lens of, this cool little product over here, which, by the way, I took this photo. This was on my bedside table at about 10:30 at night while my wife was trying to sleep, and the flash kept just popping on and off, again, with that flash donut. And she's just like yelling at me to go to bed. And I just was like, one more photo, just one more. And one more always turns into like 25 more. All right. So, and that comes up with, okay, so how do you choose your photograph, your subject to photograph, right? And I think that a lot of times this comes down to just finding that magic in the mundane. And it does take a little bit of practice. Now, again, as a lab technician, I think that there's a lot of cool things to find in the operatory, right? So just before I pressed some of these crowns, I thought, hey, that looks pretty darn cool. Let me photograph that. Or, if you're at the chair and you start to notice these contrasting colors and materials, right? Like the nylon of these locator inserts with the acrylic of the denture, with the little fibers in there. I'm like, oh, that's just begging to be photographed. Even just day-to-day stuff, like some of the services you provide, like a reline, like how cool does a denture reline have to be to photograph it? Well, I don't know. I thought this looked pretty all right, and something that everybody's certainly doing. Even if you're not doing dentures, you're certainly etching your teeth, right? You're etching your ceramic. So I thought, oh, this little drop of yellow hydrofluoric acid coming out of the tip here. I thought, man, I gotta get that on there. When I'm picking up some of my denture attachments, right? I thought, man, the chairside material just looked super cool and organic and just almost like alive. So I thought, I'm gonna take a photograph of that. And I just put this on a clear piece of acrylic and just blasted a ton of light through it. And that's how I got that photo. And again, that was just like, eye candy, but again, when I'm lecturing and really trying to tell a story or putting together a publication, it really, really helps to show all of these things, some of the steps that I took to get it from A to Z, right? And again, this is just another shade guide. You've got all these repeating patterns and repeating shapes, look for those. This was an impression tray. GC asked me, they're like, hey, we want you to take pictures of these McGowan immediate denture trays. And I thought, how am I going to make this look cool? And I just thought, I got in really, really close. I kind of stepped back and took the photo from a slightly different angle. And I don't take photographs of my teeth all the time head on, right? These were just a couple veneers that I had. And I just really wanted to show, the texture on the stone, the texture on the glass. You know, and same thing when I do dentures. I want to show this was just wax. This is done by my good buddy Arian Deutsch out in Phoenix, or out in Arizona, right? And I thought, man, nobody does wax like he does. This is just the wax setup. So I wanted to really show off that wax and the texture on these teeth. And then when I was at my buddy's office, he's a ceramist. You know, he had this bowl sitting there with this really crazy ceramic brush that was gifted to him by one of the top ceramists in the world. And I thought, man, that just looks beautiful. So again, finding that magic in the mundane, just everyday stuff. It doesn't have to be a showcase. It doesn't have to be a single central that you just knocked out of the park, right? It can be just the everyday stuff. And you just really need to practice with that, you know. And, you know, part of that practice comes down to the composition. And this Ansel Adams, everybody here knows who Ansel Adams is, right? He said, there's nothing worse than a sharp image of a fuzzy concept. So kind of knowing how you're going to do this stuff and what you want to get the photos of, you know, really helps ahead of time. So all of these images that I'm showing you now, these were actually taken, these next couple of photos were taken by students of mine at, you know, some of the live courses that I put on. And, you know, these courses, it was just like a, you know, a 6-hour course. So this photo on the left was taken by one of my students, you know, before we did any lecture, any instruction. And then within 2 hours, these are how her photos looked, right? Same exact student, same exact lens, same camera, same light setup, same everything. I just showed them within a couple hours how to tweak that stuff. So again, for anybody that thinks, you know, that this stuff, that the equipment is expensive, that you can't learn it, it'll take a lifetime to learn, it doesn't. These were people who had never, you know, this was the best photograph that they had. This is what they were sending to the laboratory for their shade photos, right? Same thing here. This image on the left was like, you know, as soon as they walk through the door, before we start the lecture, show me your best photos. Show me how you're taking photos that you're putting on your website. And then within an hour or two, this is how they were taking photos. And again, they're just composing those photos. They're getting in really, really tight, making sure that the subject fills the frame. They're not shooting, you know, from underneath, shooting up at the patient's nose. They're standing behind the patient now. They're finding the unique angles, right? Modifying some of their light settings, modifying some of the settings on the cameras. Like anybody who's got, you know, a contemporary camera, you're probably capable of taking these photos. You just don't know it yet. And I just wanted to point out and to say that, you know, money, I hear people all the time talk about money. And it's like, I don't have enough money. I don't have money. Money is not your limiting resource. It's imagination, right? But again, like anything, like if you want to learn to ski, ride a bike, prep a tooth, right? Do a really good root canal. It takes a little bit of effort, right? In order to get better. And the nice thing about cameras is, you know, it's better than the old days when we used to have film, like, you know what I mean? It's just pixels now. There's almost no cost. There's very little overhead with this now, right? And, you know, something that took a while to kind of get into was this kind of going to the lion's den, you know? And when I say the lion's den, I mean, if you're a general dentist, you know, go to the specialist's office. If you're a specialist, go to the laboratory technicians, you know, go to their office and get these photos. Again, if you want these photos, you know, I hear the excuse all the time, you know, from technicians too. I just have, you know, the after photos, right? Or I didn't get any after photos. I just got shade photos and I don't know how my thing looked in the mouth. Go to the dentist's office and take the photos for yourself, right? And there's so many photos that I have that I never would have gotten had I not gone to the lab while they were, you know, building this stuff out, putting things together. Again, I don't do surgeries. If I didn't, you know, go to you know, oral surgeon's office to get the picture of this tooth that came out, I never would have had that photo. Or my periodontist's office while he's doing a crown lengthening, right? And again, like I said, I don't place implants. You know, I had to go to the surgeon's office to get this photo of this implant. And again, just taking that photo on like a bright white background, you know, that's all that it takes. And, you know, once you start getting these photos and once you start going out and like really, really putting yourself out there, I want you guys to do me a favor. If you get nothing else from this presentation tonight, you need to start marketing yourself and your products, right? Patients can't covet what they can't see, right? And too many dentists have stock images on their website, and patients now, they're savvy, right? They know that that's not your real patient, right? They've seen these, they've visited 10 other dental offices websites and they've seen the exact same woman on there, you know, the same old couple hugging themselves, like fake smiling. And, you know, they've never had a filling in their entire life. And you've got that advertised as, you know, we do dentures, right? Don't insult your patients. Like start taking these photos, put it into a book. So I've got a Mac computer. I'm an Apple guy. I'm a Canon and an Apple guy, you know, sorry. But in Apple, and I'm sure you can do this 100% on any PC, whether you've got like a Hewlett Packard or a Dell, it doesn't matter. There's photo apps on there where you can basically just take your photos, drag and drop and submit them, and then they will put them into a book for you. And it takes almost no time at all. And bang for buck, this waiting room lookbook has been one of the biggest practice builders and has had some of the best ROI ever, right? So when patients are sitting there and they're waiting for 5 minutes to come in and see me, they're flipping through that thing, right? Or when they're sitting in the chair, I've got another one chair side. So when they tell me they want veneers and, oh, I don't want my veneers to look fake, I get out that lookbook and I say, well, take a look at this. Do you like what you see, right? Imagine if you want to go get a tattoo, right? Would you just take the tattoo artist's word for it that their work is pretty good? You'd want to see their work. So start really publishing your work and putting it out there. And if you're, a general dentist or, kind of specialize in cosmetic dentistry, if you're a specialist or if you're a laboratory technician, you want to get new clients, new doctors to like send stuff to you, right? This is what you do. And you take a book like this, maybe it's $25 a book, you order 20 books, it's going to cost you about $500, right? Go deliver those in person with your, customized referral pad. If you've got a couple papers out there, print out the papers in color, give that to them. If you are lecturing, give them a free lecture, give them some free CE, give them a lunch and learn, right? Don't just give them this thing and say, hey, send me patients, dummy, right? Don't do a cold call like that. It's not going to work. You have to give something to get something. All right. And this is just kind of a look inside of this book. And now I have very, very different books now, right? I have one that's very patient friendly. And I have a different one that I give to the dentist that I want to refer to me. So if you take a look at this image down here, right, that's blood and guts, man. I know dentists, you guys love this thing. You're like, yeah, man, this is like tooth porn. You love it. It's great. Patients don't like this. They think this is horrible. It'll be a huge turnoff. Ask me how I know. Do not have blood and guts like that in the patient waiting room. All right. So this quote by Amit Kalantri is great. A photograph shouldn't be just a picture. It should be a philosophy, right? And again, so with my philosophy is, right, I always want things to be better. I want it to be crisper, cleaner, nicer, right? But I know for a lot of people, I do realize that this is very intimidating for you and that your philosophy is going to be like, well, I just need to get it done. I've got, a high volume practice and I don't have time to do this kind of stuff that you're doing, Miles. Is there a different way? Yeah, there actually is a different way. And, a lot of people ask, can I just take photos with my smartphone? And the answer is, yeah, you can. And actually this photo here was taken in Austria with my iPhone 10, I think, right? So you can get absolutely phenomenal photos with your cell phone if you know how. Now there's issues with taking dental photos. Taking a landscape photo is one thing, right? But there's different issues when you want to start taking dental photos, because in order to get enough light in the mouth, you need to get really, 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 really close, right? And what happens is it starts to look like you're looking through the peephole in the hotel room when the people come in and you see everything looks exaggerated and they look like somebody from Whoville, right? So there's a proximity problem. It's not because it's a wide angle lens. That's nonsense. A lot of people think that that's what the problem with cell phones in. That's not the case. It's a proximity problem because you need to illuminate the mouth enough. And in order to illuminate it, you need to get in close with the flash from your phone. So again, this is what my wife's teeth look like with just an intraoral photograph with my cell phone. And then this is with the DSLR. So how do you get these DSLR-esque type photos with your cell phone? Well, as it turns out, there's products out there that have very small learning curves. They're inexpensive and they help you to do video and instantly communicate with your lab, right? So how are we going to do that? Well, as it turns out, the sponsor for this webinar, Smileline, makes this absolutely phenomenal product that I don't know how I would live without this. And just between you and me, even if they fired me today, I would own stock in this product right here. This is called the MDP. It stands for Mobile Dental Photography. And you can see it's like a small little device that your cell phone hooks up to. And you can take absolutely phenomenal photos with this. It's got some little LEDs on the side, and I'll show you a video here in a minute. This is my poor daughter's teeth. And again, if you're a specialist, if you're an orthodontist, if you're a prosthodontist like me, and you need to take these high-end photos, you can get high-end photos with your cell phone. These were all taken by a cell phone. And let me just mention one thing, by the way. Every photo that you guys are seeing in here was taken by my wife. My wife isn't a dentist. She's not a dental assistant. She's none of that. She has a master's in political science, and she happens to be my lab coordinator now. But I showed her in about an hour how to take photos with the cell phone with this MDP, pretty much right out of the box. And these were the photos that she was taking. This photo right here was taken at our dinner table. I had my daughter brush her teeth so we could send these photos to the orthodontist. My buddy who's an orthodontist to say, hey, how are we gonna fix her teeth? Another thing, again, because I'm lecturing and I'm out of the office so often, My wife is there, manning the fort, and people will come in all the time off the street wanting to have a consult with Dr. Cohn. They heard so much about me. And so what she'll do is she'll sit them down. She'll get out the cell phone. She doesn't dare use my DSLR camera because she knows how much it costs, and she paid for it. Because she, like many offices, she's the boss. I just do all the donkey work. So this photo here was taken by my wife, and I'm out in Chicago lecturing or something. And she says, "Hey, Miles, this guy came in today, wants to know if he can have veneers. Should I set him up with you?" And I said, "No, the first thing he needs to get is a good cleaning." Before we start making impressions, before we start doing all this stuff. And also I can see that he's got this kind of like weird end-to-end occlusion with his lateral and the canine there. So he's going to need an ortho consult. So get him set up. So again, my wife is taking these photos while I'm gone. Same thing with this guy. We did a veneer prep on this, and I'm just sending this off to the laboratory to ask them, this is real time while he's sitting in the chair being like, "Hey, is this enough room to do what you guys need?" This is clearly enough room, but this gives you some kind of indication. I can show them where his bite is. We can talk in real time. Again, this is another photo my wife took where she said, "Hey, this nice woman came in. She's 85 years old, had all this work done by this implant guru down in Boston. And she wants to know, she just wants to get a good cleaning." And I said, "She needs more than a cleaning here, right? Let's get her over the oral surgeon. This is going to require something more than what I'm capable of just as a prosthodontist, right? This is a real serious issue here that she didn't even know about." That my wife was able to see based off of the pan that was taken. She's like, "This doesn't look right. Some of these implants aren't attached. What's going on?" So just, again, a little detective work. And she found out, like, yeah, when it looks that bad, from the outside, it usually looks that bad underneath as well. But something interesting, with this too, is you can take some of this creative photography. This is my daughter's eye here. And again, look at the catch lights. You can see where some of the lights from these LEDs are in the corner of her eye. And again, when I'm in the laboratory, these were some of these Smileline brushes that they sent me. These are these beautiful Respect brushes. These are these vegan brushes. I'm vegan, so they sent me these, especially from Switzerland, to say thank you before they were released. And this was like a photo I took just sitting on my lab bench of these teeth. This was a picture of those brushes actually on the handle, the special handle that they sent me. Again, just set that handle on my iPad, took the photo with my cell phone. Got a denture out, took a couple photos of this denture on an iPad. Again, and you could put these on your website. And if I didn't tell you guys that these photos were all taken with a cell phone, you probably wouldn't think it, right? You'd think, "Oh, these were probably taken with a DSLR camera. Look how nice, look how moody these photos are. That's not a cell phone pic." And check this out, right? So this image on the left, that was actually taken with a cell phone. The photo on the right was taken with my $5,000 my really expensive DSLR setup now, right? I think the photo on the left actually looks much better than the photo on the right. So again, your photos can look absolutely outstanding just with a cell phone. So bang for buck, it's hard to go wrong. And of course, you can do really, really high-end aesthetic cases with this. You can do shade photos, right? Where you're looking at the value, you're looking at the hue, and you can communicate real time with the laboratories. And a lot of people want to know, yeah, but what about, the cross-polarized, some of these real fancy docs out there that are doing the cross-polarized photos, right? The polarized. You can do cross-polarized photography with this too. There's a little clip-on attachment here. It clips on with magnets, comes off, and you can get that sort of matte finish look where you can see deep into the tooth, where you can see, all the intensives and the opacity and the translucency, right? Laboratories love this stuff. And again, I'm out of the office so frequently, patients come in, especially during this COVID time. We were trying to limit exposure. So, I wouldn't go into the room. We'd have just one assistant go into the room rather than 3 people going to the room, because you don't know if the patients are sick or not. All you know is that they broke a tooth, and we need to know if it's restorable or not, or if I need to send them to the oral surgeon to get it out. So, assistant goes in there. My assistant, my wife, goes in, takes a photograph of this, comes to me when I'm in the laboratory and says, "Hey, Miles, is this something you can restore, or do you need to send this off?" And we ended up doing, just like a core buildup and resident repair for this guy. This was a patient that came in, and again, we saw her during the pandemic. Took a quick photo, did a radiograph, sent this over to the oral surgeon, and I said, "Hey, while we're here, let's take a quick little video." And so we took this little video. So this was a video that was taken with the MDP. You can see this now, and again, it's just my wife using this thing. Patient comes in, she's got a crown that had fractured. Wanted to know if it was something that we could repair, didn't know if she needed to get it out. So again, you can see the lights that are shining from the MDP just on the patient. And this is all like real time. And this video, it's not, a gigabyte in size or anything like that. It's pretty small. You can see we've got some retractors in there. And the nice thing about this is my wife can like zoom in now. She can just take that camera and just pinch and zoom. and getting really, really close. And you can see everything that you need to see with that. So again, and then she just hits send. That's over at the oral surgeon's office, and they're waiting for her to come over, you know, when that breaks. And, you know, this is something that really, really interests you guys. I have written several papers on this. This was one that was put in Inside Dental Technology. There's also a sister one in this Inside Dentistry. This is all found on my dental photography website. If you guys go to the Catapult website too, I think there's links to this on there that you can download this, read it. Again, get in touch with me if you guys got any questions. We have stuff on DSLR photography as well. Everything that I'm showing you guys today can also be found in there. This was one that was written for a laboratory group about you know, techniques and tips for the laboratory technician, but don't be fooled. It's still very, very relevant for everybody. It doesn't matter if you're a hygienist, if you're an assistant. I've tried to make it very, very easy and practical for everybody. So this final quote I'll leave you guys with by Yusuf Karsh: the heart and the mind are the true lens of the camera, right? It's not the money, it's none of that stuff. It's just your guys' creativity, a little bit of practice, and, you know, putting yourselves out there on social media, letting your friends and, you know, colleagues be your critics. And I think that's a really fantastic way to go, and it'll be one of the best things that you ever did. So guys, I appreciate you spending the evening with me. If you're on the East Coast, I guess it's, you know, early evening. If you're out on the West Coast, if you're on the West Coast, I hope you guys are staying cool. I know it was a scorcher out there. I was just in Oregon a few days ago, and that was hot enough for me when it reached about 100. I know it was well over that today. So again, thank you for joining me here today. Again, huge shout to Catapult Education for hosting this. Thank you to all of the sponsors, you know, Smile Line, here's their webpage. Here's my Instagram handle if you guys want to follow me if you're not already. Here's my dental photography website, again, where you can download all of these papers. And then here's my personal dental website if you guys want to contact me that way. So at this time, we'll go ahead and we'll take some questions if you guys got them. All right, so the first question: do you always take photos on manual mode on your DSLR versus auto? 100% of the time, always on manual. And to be honest with you, I don't even know how to use all of the auto mode. I know there's like a sport mode and one for like portraits and landscapes. I have no idea how to even use those. And again, once you learn how to use the manual, I know it seems really intimidating at first. Again, in about 35 minutes, I can show you everything that you need to know, and you'll be mad at yourself that you made it seem so intimidating. Yeah, but manual, always. Yeah, manual mode is difficult for me to learn. And yeah, but I'm sure they're better. Yeah, much better. It's not as difficult as you think. Again, it's the same thing with being like, do I need to go through dental school to become a dentist? Like, yeah, you know, it's actually not as hard as you think that it is. You know, once you're through, you're like, oh, that wasn't so bad. So, okay, next question. Do we need to use a consent form before taking a patient photo? Yeah. Do you need to? No. Should you? Yeah, 100%. Get in touch with me. I will send you our consent form that we use, and it's just boilerplate language. I've never had a patient retract their photos. I always tell them, hey, if you want, do you mind if I show full face photos? 99 out of 100 patients are okay with it. We have a few celebrity patients that really don't want me to show their pictures, and I respect that. And I don't. So every photo that you've seen was with somebody's consent. And again, like I said, patients are usually, they love that you're fussing over them. They feel like celebrities, even if they're not. They love it. And many of these photos, when you start doing these portrait photos, I tell you what, I see so many of my patients use these photos as their like Tinder profile picture. Maybe Tinder isn't the right one. I don't know. I don't do that kind of stuff. But they will use it for their Facebook profile. They will use it for their LinkedIn profile. And I tell you, man, that is a great way when their friends and family are like, wow, I love this, such a good photo of you. You know, where did you go to get it done? And they're like, oh, my dentist gave it to me for free. And they're like, your dentist took the best photo of you I've ever seen? Wow, that's bizarre. You know, and they start to think, oh, gosh, if he's that, you know, obsessed about his portrait photos, how's his dentistry, right? Huge practice builder just from taking nice headshots of people. Thanks to Anonymous, whoever said, wow, amazing photos. Thank you very much. Always room to learn, still practicing. You know, many of these photos, I have what I call an 18-month rule. 18 months from now, many of the photos that I take, I will be embarrassed by. And when you first start out, that's like a 3-month rule. You will be, you know, after the photo courses I teach, people are usually horrified at the end of that that day that like, gosh, I can't believe I ever posted some of the photos I did. And I usually see people go and they delete their Instagram account and they start fresh again. The next question says, can you review ring flash versus point flash? In this webinar, that would be a very difficult thing to review. Get in touch with me afterwards and we'll talk offline. I'll give you my cell phone number. We'll connect. We'll chat. We'll do a FaceTime. I'll show you live how that works. And let's see, is there any other questions? Let's see, Lisa, is there anything else that I'm missing here? Let me see.
No, I think that is it for now.
Okay, thank you guys for the questions. And again, if you have any other ones, ask them. It's interesting how like a lot of the stuff that you guys see in here and a lot of the stuff in my live courses came from, one question that somebody asked that I thought, gosh, I never thought about that. I don't remember learning like that component to this. So yeah, just again, feel free to reach out to me anytime after this. I really enjoy talking about this. And I think, again, is this going to be live? They'll have this kind of forever. This will live on Catapult's website, right? And I think they're going to put it on their YouTube channel. Lisa, is that correct?
That's correct.
Yeah, so if you guys missed something, I know some folks said that they had an emergency patient. Definitely take care of your patients. Patients versus photography, it's not that big a deal. Yeah, go check it out afterwards, watch it again. After you've seen it a second time, get back in touch with me with whatever questions you guys have. Always happy to answer. And again, yeah, thank you to Catapult, thank you to Smile Line for making this possible tonight. And thank you guys for attending. I really, really appreciate it.